And welcome back to the NHSC site application process. Today we'll be talking about sliding fee discount program and the site data tables. As always, all this information can be found on the HRSA website under the National Health Service Corps, and everything we reference is in the NHSC site reference guide. So please read before you start the process of creating your application for the NHSC site application. So the sliding fee discount program, every site must use a sliding fee discount program to ensure patients have access to all primary care services regardless of their ability to pay. So eligibility for your sliding fee discount program must be based solely on family size and income, and at a minimum applicable to all individuals and families with annual incomes at or below 200% of the most current federal poverty guidelines. So it should only have those two bullet points, should be your main focus when creating your sliding fee discount program, or if your organization already has established one, these are the two minimum things they need. The components of your sliding fee discount program for the NHSC sites must include a sliding fee discount program policy, a patient application, a sliding fee schedule, and a posted signage. Your site should have a sliding fee discount program in place for at least 6 consecutive months before applying to become an NHSC site. So this means that you have to have data before the NHSC site application opens. So usually the site application opens in early June. So really having that from December of the previous year till that end of May. So it'd be all of December, all of January, all of February, all of March, all of April, and all of May. So that would be the 6 months before the application cycle opens. So sliding fee schedule. So your site must have a schedule of fees or payments for services consistent with locally prevailing rates or charges, and it's designed to cover your site's reasonable costs of operation. So once your site has established its fee schedule, it must develop a corresponding sliding fee schedule to ensure that uniform and reasonable fees and discounts are applied to all eligible patients. You must have based your sliding fee schedule on income and family size at a minimum, and you should revise it annually to reflect the updates to the federal poverty guidelines, since those are updated annually as well. The sliding fee schedule should cover all primary care services for the site type. And specifically, your site sliding fee schedule must include provide a full discount, aka no charge, for individuals and families with annual incomes at or below 100% of the most current federal poverty guidelines, and with only an allowance for a nominal charge, consistent, again, with your site sliding fee discount program policy. The nominal charge must be less than the fee paid by a patient in the first sliding fee discount pay class, beginning above that 100% of the federal poverty guidelines. Provide services at a nominal charge, which can be in the form of a sliding fee or schedule of discount to individuals and families with incomes above the 100% and at or below 200% of the federal poverty guidelines. And use nominal charges at a financial level that does not reflect the service's true value and does not create a barrier to care for patients. The nominal charge must not be a threshold for receiving care and thus not be a minimum fee or copayment. Of course, your organization has the discretion regarding how you structure your sliding fee schedule, including the number of discount pay classes and the type of discounts, whether it's percentage of a fee or a fixed/flat fee for each discount pay class. However, when you are developing your sliding fee schedule, you should consider the unique characteristics of your HPSA population. So do you have more low-income patients? Do you have homeless patients? Things of that nature to ensure it does not present a barrier to care for your patients. And your site must make every reasonable effort to secure payment in accordance with the schedule of fees or schedule of discounts from the patient and or any third party. So your site must accept assignments from Medicare beneficiaries and enter into an appropriate agreement with any state agency, such as Medicaid, CHIP, but your site cannot require Medicare, Medicaid, or CHIP application or proof of denial before allowing a patient to apply and be eligible for the sliding fee discount program. So even if they do have Medicare, Medicaid, CHIP, you cannot ask that, they will submit it on their application before, but you cannot denial before allowing a patient to apply. So this is a screenshot of the current federal poverty guidelines for 2023 for the 48 states. Alaska and Hawaii have different guidelines, but obviously this would be Michigan's guidelines. So this is updated every year, really within the first 2 weeks of the new year. So definitely making sure, again, because it does usually change each year, that you're having the most up-to-date federal poverty guidelines for your sliding fee schedule program and policy. And if your organization has not created their own sliding fee schedule policy you're looking to, this is the best resource. This is from the National Rural Health Resource Center. This is for critical access hospitals and rural health clinics. Obviously, if your organization, your site might not fall into either one of those, that's okay. I'd still definitely recommend checking it out because it has good resources of how to create a sliding fee scale within your organization. So definitely check it out if you haven't, or even if your organization has, really checking to see too, do you have all the information necessary for your sliding fee discount program and policy within your own organization. So this is just a sample sliding fee scale that's from the reference guide. I think it's a good example of one. Definitely the many that I've seen NHSC site applications have. So this is a percentage wise. Again, you can use a nominal flat fee as well, but this is just an example. So you have the poverty level up at the top, family size then to, and then the discount and the federal poverty guidelines mixed in to those. And you can also see for each additional person, add this much amount. Definitely have that row there too, because that is going to be a requirement when submitting the application. A lot of sites I've seen have stopped at like 8, and they don't put for that each additional person, add this, or they try to go, to like 15. You can go further down the line, again, depending on your population sizes that you see, but really you can stop at that 8, but you need for the next row then for each additional person to add this. So this is an example of the site tables you will see on the NHSC site application online. So you must fill this all out complete. I think some people, because you're already going to submit, information about the site name, site address, that they kind of leave those blank sometimes, and that will get your application denied fast because you didn't fill out this complete form. A lot of things might be duplicated or asked again, but you have to fill it out to the, to a T to make sure everything is accurate. So definitely, again, fill out that site name, site address, the date it was prepared, who was prepared by, and then the 6-month reporting period. So again, it's going to be that month, day and year to that month, day and year. So again, thinking back, if it opens in June, having that December timeframe, for applicants who applied during the 2023 cycle, they had to have it, starting December 1st of 2022 to the end of May of 2023. And then you're going to report how many total patients within that 6-month period and how many total patient visits. And then we go on to the first table. So this is patients and visits by primary insurance type. So you can see there's different primary insurance types. You're going to put the number of patients that it is for each type, again, during that 6-month reporting period. And then it should auto-calculate in the percentage of patients. But I would always double check too, using a calculator to making sure that information, that the percentages are coming out to 100%, that it's accurate, because, can always have glitches. And then with the number of patient visits, the same thing, and that calculation of percentage of visits. Table 2 will be about patient service, charges, collections, and adjustments. So this can stump up a lot of people too, because again, it is subtraction and a little bit of math here. But basically what you include, so if you take example for Medicare, whatever the full charge of that payment source, you put in column A. For B, the amount that was actually collected from those Medicare patients, put in B, and then it's just adjustments. So this is would be whatever full charges was A, and minus amount collected B is your adjustment. So that sometimes stumps people up, but just a little FYI, that's really all you're doing is just A minus B equals C for each column or for each row there for the insurance type. Table 3, this is patient applications for sliding fee schedule. So like we talk about the applications for individuals. So this would be the number of applications approved. And then the second row is applications not approved. So you put how many number each for that and do 1 minus or 1 plus 2 here because they want the total applications received. So this would be just totaling rows 1 and 2 for 3. And then table 4 is service site staffing. So this will ask how many FTEs for each of these medical service types. So filling this out, if you don't have any for a certain one, please put a 0. Don't leave it blank. Just put a 0. But for the other types, obviously filling in the accurate amount of FTEs. And then it continues on for any ancillary services, dental services, and behavioral health services. So again, if it's a 0, put 0. But for all other types, if there is, you have 1, 2, whatever the amount of FTEs, definitely putting it accurately in each of the rows. So who submits data tables? So the exempt facilities, so FQHCs and FQHC lookalikes, do not have to submit data tables when submitting an NHSC site application. Free clinics also don't either, but I do put an asterisk there because if it is a free clinic, if the NHSC HRSA requests a site visit or requests more information later on, definitely they have to have information or some type of, documented that their clinic is free. So just a little FYI on that, that for those free clinics. And then also Indian Health Service facilities, federal state prisons, and ICE facilities don't have to submit data either, but they can upon request. So there needs to be some information like the free clinics. Most of these facilities don't offer charges, or to their patients, but there needs to be some kind of documentation that we do not, submit any payment or charges towards these individuals, but they do not have to submit the data tables via the NHSC site application. So that's just a little nuance there that I like to give clarification on. But if your facility or site type does not fall under any of these, then they'd be non-exempt. So you would still submit the data tables for your NHSC site. And if you have any questions, again, feel free to email me there.